I've also been asked to provide some comment today on the death of Eileen Hunter, a resident from St Margaret's Hospital and Rest Home in Te Atatū, Auckland. Now, it's important to note that Eileen was regarded as having recovered from Covid-19 at the time of her death, and Covid-19 is not recorded as the primary cause of her death on her death certificate. However, after consideration, we have decided to include Eileen's death in our overall tally of Covid-19 related deaths, consistent with our inclusive approach to date, so that we have got a good idea of the full impact of this condition on our health and wellbeing in New Zealand. This means our total number of Covid-19 related deaths is now 22.
Given you're looking at the excess deaths numbers, how much could we have underestimated the death toll? Some people are saying up to half.
Yeah, so I think in New Zealand, we've probably got a reasonably accurate picture of the number of people that died from the disease. But certainly, yeah, in some parts of the world, the UK in particular, it may be underestimated by a factor of 2. And we're just very, very lucky to have not been in that position.
Would that be the same in the US, presumably?
Yeah, and similar in the US. I mean, it depends in different parts of the US. The disease has certainly hit some places much harder and earlier than other places. But in New York, for example, it's quite likely to have been underestimated by a similar amount. And also, it appears the disease was circulating for quite a while in Washington state before it was detected. Yeah. So there's a suspicion that there's quite a large number of deaths that before there were even tests available were occurring in the US.
So, and obviously the other one, I guess, would be China, right? At some point they doubled their death count, but I mean, it's still a very minute number for a population that lives that densely and that didn't really obviously have a handle on the virus when it was spreading first. Yeah,
China's such an interesting case because it did, it's where the disease first arose, but then they acted once they sort of accepted it. It took them a while to really accept what was going on. I think partly because of the political system there, they acted very very robustly and locked down Wuhan, for example. One of the things we've seen by comparing New Zealand to Wuhan is actually our lockdown was similarly effective. We brought the disease under control as fast as the Chinese did in Wuhan, and we did it without in a democracy. I think that's something we can be proud about.
No welding doors shut here, we hope.
Yeah, that's right. Yeah.